Hi, my name is Ruben Avila. I'm in Health 100 along with my partner, Godwin Alozi. The topic we chose was schizophrenia, and we're going to explain how it works and how it affects the human brain. Schizophrenia is a mental disorder that makes it hard for the human to tell the difference between what is reality and how to act normal in social situations. It's a really complex illness. Health experts are not sure what really causes it. There has been an agreement, though, that what causes schizophrenia is interplay between biological disposition, inheriting certain genes, and the environment that the human is in. Environmental factors can play a role later in life. Schizophrenia and a number of other mental illnesses is caused by a combination of biological, psychological, and social factors. Schizophrenia in children is rare. It usually begins around age 5. Since children get this mental disease so rarely, it's hard to tell whether it's autism or other developmental problems. Symptoms develop over month periods and years. This disease occurs in men just as much as it does in women. The only difference is women have a milder condition. Early symptoms have a milder condition. Early symptoms include irritable or tense feeling, trouble concentrating, trouble sleeping. When the illnesses continue and gets worse, it turns into hallucinations, isolation, reduced emotions, problems paying attention, delusions, and speaking in a way that makes no sense. As you can see right here,
As you see in the picture, the guy looks very paranoid. Symptoms of schizophrenia may include hallucinations, delusions, paranoia, hearing or seeing imaginary things, wildly false beliefs, and paranoia, the fear of others are plotting against you. Some symptoms, such as a lack of enjoyment in everyday life, withdrawal from social activities, may mimic depression. Most schizophrenic people have abnormal ways of thinking. They have trouble organizing their thoughts and making logical connections. Their mood swings could become very violent if in a stressful environment. Despite popular belief, schizophrenia is not a dissociative identity disorder, multiple personality disorder. Schizophrenia can also cause repetitive behavior such as pacing in contrast to common stereotypes. The risk of violence against others is small.
Thank you, Godwin. You heard it from him. Usually the treatment for schizophrenia is medications like antipsychotic medicine, which is the most effective. They change the balance of chemicals in the brain and help symptoms. Sometimes, though, doctors they give medication that causes the exact opposite, which is a chemical imbalance, which could cause another episode. Side effects from antipsychotic medicines include dizziness, feeling of restlessness, slowed movements, tremor, and weight gain. Long use of medication could possibly cause tardive dyskinesia. The condition causes uncontrollable movement. Schizophrenia is a lifelong illness. Most people stay on medication for life. You can see right here. Read that.
As you can see here, this is a picture of two brains, which are twins. And the brain to the left, that's normal. To the brain to the right, it's a schizophrenic twin brain. The circles show it all where the damage is done to the brain. Brain scans, identical twins show that the fluid-filled ventricles can be larger in the twin schizophrenia. Levels compared with twins who does not have the illness, activity levels can also be higher or lower than normal in some areas of the schizophrenic brain. There are no lab tests to detect schizophrenia, so a diagnosis is usually based on history and systems.
Thank you. Alright, now Godwin's going to explain to you in his own words what schizophrenia is. Yes.
Hi, my name is Godwin Alozi. I'm Ruben Avila's partner. We have chosen the topic schizophrenia for our health class. Schizophrenia is a chronic disorder that has occurred and happened to many people throughout time. Patients or people with this disease do not make sense that they cannot function well psychologically. There are certain people seemingly means perfect, but they can also cannot trust people functionally with having schizophrenia. They can also change their alter judgment when talking to others. Lives of schizophrenia can bring many stories in their own towns. They can be a burden when trying to care for others or try to get a job. In the USA, 1% of the population have schizophrenia. Schizophrenia have hallucinations that can make them hear or smell things or can make them also hear voices. This diagnosis causes them to have these abnormalities where they can be in a room and start to smell or hear things or hear voices. When they have delusions causes them to start to mutter when they talk, which is hard to have a conversation with them. The best thing to do with having schizophrenic or being around them is just, you know, talking to them normally, though the conversations might be tough. Ideally, when being around schizophrenic people, you kind of have to be on your pins and needles about them. Their mood is almost like a ticking time bomb. You don't know when it's going to go off. They can be normal once, and then everything can go off the wall. As in these pictures.
Alright, as you can see here, zoom in this picture. As you can see here, this is the earliest deficient of a human brain with schizophrenia. As you see this little percentage. The more red and pink it gets, it's the worse. In some spots, it's kind of just dots, not a lot. But 5 years later, the same subjects were tested, and as you can see, schizophrenia is completely taken over the human brain. It's spread out to the outer regions and just to everywhere. This is significant loss of brain gray matter. Individuals with schizophrenia have a reduced volume of gray matter, especially in the frontal and temporal lobes. Neuroscientists have detected that there is up to 25% loss of gray matter in some cases. The damage started small, and then over a 5-year period, it spreaded to the outer regions. Patients with the worst tissue loss have the most bizarre episodes, including psychotic thoughts, delusions, hearing voices, depression, and hallucinations. Bring it to this one.